This conference will now be recorded.
Philippe is from Xibios Biosafety Consultancy. आप में से कुछ लोग उनको जानते होंगे, उन्होंने हमारे साथ पहले भी वर्कशॉप्स करवाई हुई हैं, वेस्ट मैनेजमेंट एंड मास्क मोस्ट रिसेंटली, और अगर आप लोग इसकी वीडियोस देखना चाहते हैं ये हमारे यूट्यूब पे भी हैं। आज फिलिप सेशन कराएंगे। आफ्टर ईच सेशन में उर्दू में समरी दूंगी। आई वुड आल्सो लाइक टू थैंक FIC एंड डॉक्टर ज़ीबा जो यहाँ पे FIC की तरफ से आज आई हुई है। एंड जस्ट बिफोर वी स्टार्ट कुछ रूल्स हम सेट करना चाह रहे हैं। प्लीज अपने आप को म्यूट पे रखें और अपना वेबकैम ऑन मत कीजिए। हमने ये वीडियोस अपलोड करनी होती हैं, तो अगर आप म्यूट पे नहीं होते और आपका वेबकैम ऑन होता है तो ये भी साथ अपलोड हो जाता है। तो इसलिए प्लीज अपने आप को म्यूट पे रखें, अपना वेबकैम ऑफ रखें। अगर आपके पास कोई भी सवाल है उनको चैट बॉक्स में जरूर लिखें और एंड में हम आपके सवाल डिस्कस कर देंगे। एंड विद दैट, डॉक्टर ज़ीबा, वुड यू लाइक टू से समथिंग?
I'd just like to welcome everybody as well and to thank Philippe and the PEPSA team for organizing this webinar, and we're very pleased to be a part of it. Thank you.
Thank you, everyone. And Philippe, the floor is all yours. Philippe, do we still have you?
Sorry, no, I don't see the screen anymore.
I sent you another request. Yeah, we see it.
Okay. So I don't think you had this someone before. So I was thanking you for your attendance, and I'm very pleased to present this this workshop on decontamination, especially with respect to COVID-19. There will be 4 sessions. The first session is mainly to present a few fundamentals about decontamination. So today I will first present a number of definitions like sterilization, disinfection, and decontamination, and also present you the principle of inactivation. When I speak about inactivation, it means killing. So killing microorganisms, we use the term inactivation. And then I will focus a little bit more on SARS coronavirus 2, and also with the decontamination principle and the strategy with respect to SARS coronavirus 2. So the definitions, there are 3 definitions that are mostly used in this context, and there are always a treatment or process that kills part of the microorganism. And that's different from cleaning. When we speak about cleaning, we speak only about removal. It can be dust, it can be blood, and it can also be microbes. But there is not necessarily a killing of the microorganism. On the other hand, when you speak about sterilization, disinfection, or decontamination, inactivate, we kill the microorganism. So sterilization is the most drastic treatment that destroys or eliminates all forms of life, including the most resistant species. So in that case, everything should be eliminated. When we speak about disinfection, that's the treatment or process that kills viruses and vegetative forms of microbes, but not necessarily spores or other resistant forms. So it's already less powerful, I would say. When we speak about decontamination, then we don't really say what it kills. The purpose of that treatment or process is to make things safe and suitable for further use. So it will depend on the type of contamination, and we'll get rid of that contamination so that the things that we need to use after that, or the waste that we need to discard, are safe and suitable for when they are objects. So, as I said, sterilization is the description or elimination of all forms of life, spore included. And actually, the level that is set for declare sterilization is that we have a reduction of 10⁻⁶ of the resistant spores. That means that we have a process that kills the spores to the point that not more than one spore out of 1 million may survive. So it's really an extremely demanding treatment. And if you kill so many spores, of course, you kill all the organisms that are less resistant. It can be done by physical means, like autoclaving, for instance, or chemical means, like using disinfectants. And in this case, it must be a very powerful disinfectant. So some examples of sterilization, you need to sterilize tools and devices that are used for surgery. In that case, those tools, devices will be in contact with the inside of the body, so it's really important that it is sterile, that they are sterile. Then we can also sterilize media and materials used in sterile processes. If we, for instance, want to culture cell lines that are sensitive, we'll need to have sterile media and materials. And then finally, also for biopharmaceutical products, such as those that are injected into patients, like vaccines, for instance, most vaccines. Disinfection is the inactivation of vegetative forms of life. And so disinfection is totally suitable when you know that you don't handle spores, for instance. But the requirements for disinfection are variable. They depend on a number of things. First, on the purpose, and then you can have high, intermediate, and low levels of disinfection. I will explain that a little bit more just after this. And also, you might have different requirements depending on the target organism, on the organism that you want to kill. And that will be the object of the second session. Disinfection is almost always done through using chemical process, so using disinfectants. Examples are disinfection of the hands prior to or after hospital work, or when leaving a lab, for instance, and also the surface disinfection of biosafety cabinets, other pieces of equipment, bench tops, and so on. So the different levels of disinfection, you have a high-level disinfection, and when we speak about high-level disinfection, that means that we want to kill all forms of active life, bacteria, fungi, and viruses, not necessarily spores. And we use that mainly for medical devices. So if you don't need sterilization, for instance, because the medical devices are not in contact with your inside, in that case, high-level disinfection is still needed. So not sterilization, but high-level disinfection. Intermediate level disinfection is also the killing of all vegetative bacteria, fungi, and so on, but not necessarily all viruses. And that's what is mostly used in hospitals and also mostly used in laboratories. I would say that the main exceptions is for laboratories that use resistant viruses, for instance, or that use other very resistant organisms. In that case, they will need high-level disinfection. Then low-level disinfection is also the killing of the same type of organism, but when the risk is very low. And so it's used mainly for the floors in hospitals or for disinfection in a household, for instance. If in a kitchen you want to disinfect the tabletop, in that case, you want to do more than cleaning, you will have a low-level disinfection. For that, some low-level disinfectants can be used. Then finally, decontamination. Decontamination is making all objects or items that need to be reused, for instance, safe for further use. When I say suitable, that means that the treatment should not destroy or alter the things that we still need to use. Decontamination is also used for waste. In that case, it needs to be safe to protect the waste handlers, for instance, and to protect the environment. But in that case, we don't have to protect, we can destroy the waste. The requirements there are extremely variable. It's based on some risk assessment. It depends on the type of contamination you have. It depends on the concentration of the biological agent that you may have in some products, on some object, and so on. So it depends on the risk, and And in that case, depending on the risk, you will define yourself what is the level of performance that you want to achieve. It can be done by physical means, like autoclaving for waste, for instance, or chemical means, like disinfectants for a number of different objects. So examples are the treatment of reusable laboratory items like glassware, in some case lab coats and so on, and waste autoclaving. Then there are also some other terms used, and I won't use them anymore, but I want just to clarify a few things about that. The first two are sanitization and germicidal processes. Sanitization, in that case, we want to reduce the numbers of vegetative bacteria. So we don't speak about virus or anything, it's mainly bacteria. And it's really to be used for low-risk activities. And so, for instance, sanitization can be done in a restaurant or in a household. Germicidal processes are actually that covers any process used for disinfection or decontamination. You see that on some bottles of products, and if you see that and you don't see a term like disinfectant, so it's probably because it's a very low level of the contamination. Actually, we don't, the level is not specified in that case. So that means that it kills something, but we don't know what it kills, and we don't know to what concentration and so on. So there are various applications, but I would say that this would be also low-level applications. And then there is the antiseptic processes, and those are treatments that prevent or stop the growth of action of microbes. It's mainly for living tissues, like when we need to act on wounds, for instance. In that case, you cannot use a very strong disinfectant, because if you use a very strong disinfectant, you will also damage your tissue, and it will be extremely painful. And so because of that, you need to use very mild products, and those mild products don't necessarily kill everything, but at least they prevent the growth of multiplication of the microbes. So to finish this first part of this session, I would like to ask you a question, and to answer that question, you can use the chat box to answer that question. The question is, what treatment process do you think is needed against SARS coronavirus 2? And so the possible answers are A, sterilization, B, disinfection, C, decontamination, D, sanitization. E means that you think that there is no unique answer and that it depends on the situation. And please answer F if you don't have any idea. And of course, that should be clarified afterwards. So it's time for you to answer those questions, and also for some translation and possibly one or two questions.
So आप लोग अपने क्वेश्चंस जब तक चैट बॉक्स में लिखते हैं, मैं एक जल्दी समरी दूंगी ऑफ द स्लाइड्स सो फार। तो सबसे पहले आज फिलिप कुछ डेफिनेशंस के थ्रू हम गए थे। स्टेरिलाइजेशन वो तरीका होता है जिससे जरासीम बिल्कुल खत्म कर दिए जाए, उनसे उनका जो पाला वहां पे होता है वो सारे वहां से खत्म, जरासीम से पाला खत्म कर दिया जाता है। डिसइंफेक्शन वो वाला तरीका होता है जहाँ पे जरासीम को बामल कर दिया जाता है। हो सकता है वो वहां पर ही हो, लेकिन उनको वो अब बीमारी नहीं फैला सकते। इसमें ज्यादातर चीजें खत्म हो जाती हैं सिवाय कुछ जरासीम जो रेजिस्टेंट होते हैं, जो आसानी से मार नहीं सकते। फॉर एग्जांपल स्पोर्स, इनकी हम आगे भी बात करेंगे। डिकंटामिनेशन वो सफाई का तरीका है जिससे आपने जो चीज इस्तेमाल करनी हो वो आप उसको महफूज और मुनासिब रखें इस्तेमाल के लिए। फिर क्लीनिंग वो तरीका होता है जो सफाई का वो तरीका है जो ऊपर चीजें पड़ी हुई हो, फॉरेन मटेरियल हो, धूल पड़ी हुई हो, खून पड़ा हुआ हो, उसको खत्म कर दिया जाए। स्टेरिलाइजेशन करना, स्टेरिलाइजेशन स्पेशली उन चीजों की जो मुश्किलों से खत्म होते हैं, एग्जांपल स्पोर्स, एक काफी मुश्किल से होती है, और इसको दिमाग ज़हन में रखना चाहिए जब भी हम स्टेरिलाइजेशन कर रहे हो कि हो सकता है हमें लगे कि हमने वो जगह को स्टेराइल कर दिया लेकिन वो ना हुई हो। डिसइंफेक्शन जरासीम को बामल करने के लिए आपको जरूरी नहीं है कि जो जरासीम है, जो जरासीम होंगे, जिस किस्म के जरासीम होंगे उतना मुश्किल हो सकता है। इसके डिफरेंट लेवल्स होते हैं जिनको हम डिस्कस करेंगे। हाई लेवल डिसइंफेक्शन हम करते हैं बैक्टीरिया की, फंगस की और वायरसेस की, और जरूरी नहीं है कि उसमें स्पोर्स खत्म हो जाए। ये ज्यादातर मेडिकल डिवाइसेस में हम इस्तेमाल करते हैं अगर उसमें स्टेरिलाइजेशन की जरूरत ना हो। जो दरमियानी लेवल की डिसइंफेक्शन होती है उसमें बैक्टीरिया, फंगसेस खत्म हो जाते हैं, लेकिन जरूरी नहीं है कि वायरसेस खत्म हो। ये ज्यादातर हॉस्पिटल और लेबोरेटरी का जो सामान होता है उनके ऊपर की जाती है। लो लेवल डिसइंफेक्शन में हम बैक्टीरिया और फंगाई को खत्म करते हैं, और ये लेवल ऑफ डिसइंफेक्शन हम अस्पतालों की जमीनों पे या अपने घरों में भी करते हैं। डीकंटामिनेशन जो होती है जिससे हम चीजों को महफूज और कर रहे होते हैं जरासीम से, वो आपकी रिस्क असेसमेंट पे बेस्ड करती है। अगर एक आपकी रिस्क असेसमेंट पे बेस करती है, और ये हम इस्तेमाल करते हैं जिस तरह के लेबोरेटरी के वो वाले सामान पर जो बार बार यूज होते हैं, जिस तरह के लैब कोट। यहाँ पे हम वेस्ट ऑटोक्लेविंग में भी डिकंटामिनेशन कर रहे होते हैं। कुछ और टर्म्स भी फिलीप ने आपको समझाए थे। सैनिटाइजेशन होती है जिसमें आप बैक्टीरिया को कम कर रहे होते हैं, जरूरी नहीं है कि सारा खत्म हो जाए। जेनोसाइडल प्रोसेस में भी यही हो रहा था, इसमें वेरियस एप्लीकेशंस हम घर में भी यूज करते हैं। एंटीसेप्टिक प्रोसेस के अंदर हम बैक्टीरिया को बढ़ने से या ग्रो करने से रोक रहे होते हैं, एंड ये हम लिविंग टिश्यूज पे यूज करते हैं। फॉर एग्जांपल अगर हमें जख्म या कुछ हो जाए तो हम उसके ऊपर एंटीसेप्टिक प्रोसेसेस अप्लाई करते हैं। एंड अब मैं फिलिप को वापस दूंगी, एंड वी विल गो, एंड आपके आंसर्स के थ्रू हम जाते हैं। Dr. Ziba, would you like to do the questions?
No, I thought Fariha was doing that.
Okay.
Fariha, do you
right. Assalamu alaikum, everyone. So, Philippe, our first question is, which consequences are used in sterilization and disinfection, decontamination of COVID-19?
Excuse me, can you repeat, please?
Which consequences are used in sterilization, disinfection, decontamination of COVID-19? तैयब खान, आप काइंडली बता दीजिए कि आपके क्वेश्चन का मतलब क्या है, which consequences का क्या मतलब हुआ, आप इसको प्लीज क्लियर कर दीजिए. Otherwise we have a couple of comments and a lot of answers to the question.
Yep,
I think
So, right.
I think that I'm not sure I understand totally this question, but I think it will be answered in the rest of this session. So I propose not to answer, and if the question is still valid, we can still discuss about that at the end. Is that okay?
Yes, the question is not clear, so I've asked the participant to rephrase it.
Okay.
So we have no questions till now.
Okay.
Philippe, what you're looking for is the answers to the questions you had, correct?
Yeah, and I think it will be the question. I think will be clarified in the next part. So, okay. So let's move to the second part. So now we'll speak about the resistance and sensitivity of biological agents in general first, and then we'll look more precisely at SARS coronavirus 2. So when we think about biological agent, microorganism, we see a huge diversity of agents. There are very different types of bacteria. Some are pathogenic, some others are not. Very different types of virus. We have fungi, we have some other microorganisms. They differ in their shape, morphology. They have very different biological mechanisms, some very simple, some extremely complex. Some may be pathogenic and some highly pathogenic, and some others can only cause mild disease or no disease at all. And then there are also many differences in the transmission, the way they transmit and the way they infect people. And that's quite important with respect to resistance. And I will give a few more explanation about that. Then also all those organisms have different host range. Some will only infect one species of animal, or human. Some others are able to infect a number of different animals, including human, for instance. And they also have different environmental preferences. So some prefer grow better in some humid, hot environment. Some others, it's exactly the opposite. And so when we think about resistance to disinfectant, there are also many differences. And resistance to treatment, there are also many differences. And most of the time, those differences are more or less related to the resistance into the environment. So environmental resistance is important from that point of view. And when we look at the organism, we already have some information about the resistance. For instance, the agents that are transmissible to the fecal oral route, so those are generally very resistant. Examples like Salmonella, Shigella, poliovirus, hepatitis A virus, all those microorganisms, they infect our body and they reproduce in the digestive tract. They could also reach some other organ, but that's where they reproduce. And then we shed the virus through the stools, and those stools contaminate the environment. In order to be able to infect the next person, they need to be resistant because they have to survive in water, for instance, and then to survive on food or on hands and so on. So in general, those microorganisms are very resistant. On the other hand, those that are transmissible through the air are generally significantly less resistant. It's the case for Streptococcus, Bordetella, measles virus, and so on, influenza virus. Actually, those affect mainly the respiratory tract. Sorry, the respiratory tract, and when people are infected, they emit particles when coughing, sneezing, and so on. In that case, you have liquid droplets, aerosols that are disseminated. And actually, they will transmit quite easily through this way, and they will mainly reach people who are in close contact with the people who are coughing or sneezing. And so they don't necessarily need a very high resistant profile for that. The contamination of others, the contamination of things and so on is quite immediate, and the chance to infect somebody else is quite high. And then, of course, you have the spores that are developed by some bacteria and fungi really to resist very tough environment, very difficult environment. So these are very general trends, and there are exceptions. One exception is Mycobacterium tuberculosis, which is one of the most resistant bacteria, for instance, even if it's an airborne pathogen. Anyway, resistant to the treatment is more or less related to resistant to the environment. So the organisms that we see as the most resistant to the environment are also those who are the most resistant to disinfectant, for instance, to other forms of treatments. This is a quite classic table that you will find in many books on decontamination and sterilization and so on, and also on websites. It's the table that shows the different types of microorganisms and their with respect to their level of resistance. The most resistant, like prions, are on the top, and the less resistant are at the bottom. So you first have prion, and then you have bacterial spores. They are made to resist, so they are highly resistant. Then you have mycobacteria. And then some small non-lipidic viruses. You have poliovirus, hepatitis virus, for instance, which are there. Fungi, then gram-negative bacteria, which are the most resistant among the bacteria. And then you still have non-lipid virus, but the largest one, like foot and mouth disease virus, rotavirus, but they are still quite resistant. Then you have some other bacteria, mostly the gram-positive. And then finally, the less resistant are lipid viruses or envelope virus, like HIV, hepatitis B virus, herpes virus, influenza virus, and also coronaviruses. So coronaviruses are among the most sensitive, the less resistant viruses. That's a good thing to know. And I think we're lucky that this one is a coronavirus, actually. Of course, these are general trends and there are exceptions. So if you have something, some agent that is worrisome, like coronavirus, we need to check that it is not an exception. These are the inactivation curves of different types of organisms. When I say inactivation curves, that means a curve that shows the killing of the organism. So if you look at the red curve, in that case, you see that we first have a shoulder. That means that over time, most of the microorganisms they're still living, and then after some time, then there is a decrease, and a number of the agents they die, and finally at the end there is nothing or almost nothing left. So if you look at the blue curve, which is of a sensitive organism, in that case you don't see such a plateau shoulder. You have an immediate decrease, and also the slope is much steeper. That means that very rapidly the microorganisms die, and finally you kill everything much earlier than with a resistant organism. So two things: the shoulder in a resistant organism, and also the slope, which is less steep. And this shows the natural inactivation. So for instance, if we don't do any treatment, there will be those two types of curves. But it also shows the inactivation curves when you use a process or a disinfectant to kill microorganisms. So some general observations here. So the general trends, like for instance, the difference between fecal oral transmission and airborne transmission, may be useful to define a general approach to have a first ID. But since exceptions are always possible, we need to have specific data. And especially when we have a touchy situation like with this COVID-19 pandemic, in that case, we need to check that coronavirus is indeed among the less resistant microorganisms. Actually, the purpose of the contamination process is to increase the speed of natural inactivation. All microorganisms, they finally die. In using a process like autoclaving or a disinfectant, we want to increase the speed of natural killing, natural inactivation. In doing that, we shorten or delete completely the plateau, the kind of shoulder there, and we also increase the slope of the curve. Now, what about SARS coronavirus 2? Apparently, and all the studies until now show that, and so it's really something which is confirmed, it's more or less similar to SARS coronavirus 1. So the difference between the two, the fact that this one is pandemic and the other one was not, is not due to the resistance. They are very similar from that point of view. One of the first studies that was published, I think it was already in early March, about this on SARS coronavirus 2 showed that the virus stays alive, could still be detected. For instance, for more than 3 hours in aerosol droplets, for 4 hours on copper, 24 hours on cardboard, and 72 hours on stainless steel. So such figures, they made most people think that, whoa, we have something which is quite resistant here. 72 hours on stainless steel, it's quite long. However, if we look at the curve on the right hand side, you see that indeed we have a decrease, and you see that after 72 hours there are still some virus that can be detected, but it's very low concentration. And if you look at the scale, we have 10, which is 1, 10, 1, which is 10, 100, 1,000, and 10,000. So it's a logarithmic scale. If you put that into a normal scale, you have this graph, and you see that even if there is still some virus living after 72 hours, it's really a very small quantity, but that most of the virus has been eliminated naturally after 5.6 hours, and that after 10 hours, 75% of the population of the virus has disappeared already. So clearly, SARS coronavirus 2 is a poorly resistant virus. It's a sensitive virus, and so, despite the situation, we are lucky that it's so poorly resistant. So it's not a surprise that it's a sensitive virus because it's an envelope virus, and you see on this graph on the left part, right part, that the red, I think. That's the lipid envelope. it's a big advantage for the virus that have that, because they can really merge with the membrane of the host cell. It's a competitive advantage for them because they can more easily penetrate and colonize the organism. But it's a weakness from a resistant point of view, because some products or some process can attack the lipids, but also the fact that it's a mixture of lipids and proteins and so on make it more sensitive to the attack of a number of products. So if we summarize in looking at the sensitivity of SARS coronavirus 2, actually it's a sensitive virus, and which is sensitive to most factors, most elements that you can use for decontamination. Sensitive to UV light, sensitive to heat, to desiccation, so being in the dry environment will kill it, to alcohol, and that's very interesting because a number of viruses are not sensitive to alcohol, to bleach, to acetic acid, to hydrogen peroxide, and even to detergents and soap. And that's very interesting because hand washing, in the case of coronavirus, is a very good way to get rid of the virus. A very good and effective way to get rid of the virus. So, Mashal, we again have some time for translation and possibly some question. I will look at the list of questions during the time you are translating.
Thank you, Philippe. तो इस सेक्शन में हमने देखा था कि सबसे पहले उन्होंने हमें बताया था कि जो जरासीम होते हैं वो डिफरेंट किस्म के होते हैं, जिस तरह वो दिखते हैं, जिस तरह वो बीमारी फैलाते हैं, जहां पे वो रहते हैं और जिस तरह से उनको खत्म किया जा सकता है, वो हर जरासीम का डिफरेंट होता है। लेकिन रेजिस्टेंस जो होती है, उन्होंने लाइक फॉर एग्जाम्पल जिस तरह वो फैलाने का तरीका होता है उस पर भी डिपेंड करती है। जो चीजें फीकल ओरल रूट या फॉर एग्जाम्पल आपके हाथ ना साफ होने की वजह से और आप वो अगर मुंह में कुछ डालें जिनकी वजह से फैलते हैं, वो जनरली उनको खत्म करना ज्यादा मुश्किल होता है। इसी तरह जो हवा के अंदर होते हैं उनको खत्म करना थोड़ा सा ज्यादा आसान होता है एंड स्पोर्स को करना बहुत मुश्किल होता है। लेकिन ये सिर्फ जनरल रूल्स हैं, ये हर जरूरी नहीं है कि हर बार इसी तरह हो। फॉर एग्जांपल जो टीबी कॉज करता है माइक्रोबैक्टीरियम ट्यूबरकुलोसिस, वो हवा से ही फैलता है, लेकिन वो हाईली रेजिस्टेंट है और उसको खत्म करना मुश्किल होता है। और कोरोना वायरस हम इस तरह से थोड़े से लकी हैं कि जो कोरोना वायरस है वो एक लिपिड एनवेलोप वायरस है, उसके और लिपिड एनवेलोप वायरसेस आसान होते हैं खत्म करने में। बट और ये फिर फिलिप ने आपको कुछ बताए थे डिफरेंट बैक्टीरिया और उनका रेजिस्टेंस, जिस तरह फॉर एग्जांपल बैक्टीरियल स्पोर्स, माइकोबैक्टीरियम काफी रेजिस्टेंट होते हैं। और आप जैसे जैसे लिस्ट के नीचे आते जाएं, लिपिड वायरसेस जो कोरोना वायरस भी है वो आसान होता है उनको खत्म करना। लेकिन ये जनरल रूल्स हैं, जरूरी नहीं है कि हर चीज इसी के अंदर फिट हो, एक्सेप्शंस भी होते हैं। फिर आप अगर इस ग्राफ को देखें, इस ग्राफ का जो मेन मैसेज है जो आपको याद रखना चाहिए कि दोनों कर्व्स जो हैं, जो रेजिस्टेंट है और जो लेस सेंसिटिव ऑर्गेनिजम्स जो हैं जो जल्दी खत्म हो जाती हैं, उन दोनों के अंदर नेचुरल डिके होता है एंड टाइम के साथ साथ वो दोनों खत्म होती हैं। एंड इसके अंदर बहुत जरूरी है कि हम ये बात और इसके अंदर बहुत जरूरी है कि हम ये बात याद रखें कि जब डीकंटामिनेट कर रहे होते हैं, डीकंटामिनेशन का जो प्रोसेस होता है उससे बेसिकली हम चाह रहे होते हैं कि जो नेचुरल इनएक्टिवेशन है, कि जो वक्त के साथ साथ जो भी जरासीम खत्म होंगे जो हमने ग्राफ में देखा था उसको हम जल्दी करें और वो जल्दी खत्म हो जाए। फिर हमने ये ग्राफ देखा था और इसके अंदर अगर आप सेकंड नीचे वाला ग्राफ देखें, जो पॉइंट हमें याद रखना चाहिए है कि जो डिक्रीज होता है वो जितना वक्त गुजरता है उतनी जल्दी भी उतना ज्यादा भी डिक्रीज होता है। तो जो वायरस है वो जो सबसे स्ट्रॉन्ग होती है वो शुरू के 5 से 6 घंटों में सबसे ज्यादा फैलेगी और फिर जैसे जैसे वहाँ पे सबसे ज्यादा ताकत उसमें तब होगी कि वो किसी को बीमार कर सके। वक्त के साथ साथ वो भी इनएक्टिवेट होती जाती है। सार्स जिसे हमने बोला था कि जो सार्स कोरोना वायरस है वो लिपिड एनवेलोप वायरस है, इस वजह से वो सेंसिटिव वायरस है और हम उसको खत्म कर सकते हैं। कुछ चीजें जिनकी वजह से वो खत्म हो सकती हैं वो है हम यूवी लाइट के अंदर रखें, उसको हम हीट प्रोवाइड करें, ज्यादा गर्मी प्रोवाइड करें, अल्कोहल एटलीस्ट 70% के अंदर हो, उससे ब्लीच से, एसिटिक एसिड से, हाइड्रोजन पेरोक्साइड से और डिटर्जेंट्स और हाथ धोने से, सोप हैंड वॉशिंग से भी ये चीजें खत्म हो सकती हैं। एक बात तो सिर्फ नोट करने के लिए है कि बहुत सी अदर वायरस, हर वायरस अल्कोहल से नहीं होती। सार्स कोरोना वायरस इज ज्यादा सेंसिटिव है टू अल्कोहल एंड उससे वो खत्म हो सकती है। दैट फिलीप आपके क्वेश्चंस का जवाब देगा और फिर लास्ट सेक्शन प्रेजेंटेशन के हम शुरू करते हैं।
Yeah, I see. Thank you very much. There are many questions, and some of the questions are really not totally in the scope of this, but if there is a way to answer those questions, we also try to do it. Some others will certainly be answered in the next session. And I think there is one that I don't see it anymore.
So Philippe, we have a couple of questions. Would you like to address them right now?
There is one that I wanted to address, but I don't see the questions anymore because I see my screen. So
okay, so I'll say the question and then you can answer it. So we have a question from, yeah, so we have a question from Rida. So she says that how we can assess the profile of pathogen for the treatment options to be opted for SARS coronavirus.
How can we find a profile of can we find a profile?
Yes, how we can assess the profile of the pathogen.
Yeah, for pathogens which are already well known, there are a number of papers on that, and there are some very good summaries of that kind of information. And it's for instance, and for me, it's one of the best source for that, the Canadian biosafety data sheet. So if you look at the site of Health Canada, you have pathogen safety data sheet, and you can find a lot of information on all established pathogens, most established pathogens. If not, then you need to try to find information in scientific papers, and that's the case for SARS coronavirus because it's quite new. I'm sorry, Marshall, could you please take the screen again? I will look at the question because there is one that I want to answer now, and I don't see them when I see the screen.
Yes, can you see?
Yes. So there are a number of questions. The answer will come during your webinar, so you need to be a little patient. Yes, the question that is there. Okay, in the slide you mentioned sanitization method only reduce number of vegetative bacteria, not mentioned virus. So why we use hand sanitizer? I think it's a very good question. Actually, sanitization means that it aims at reducing the number of bacteria. But in this case, because it's a very sensitive virus, it is less resistant. It is more sensitive than bacteria, and in that case, it will also be eliminated. So in this case, because it's SARS coronavirus, which is sensitive, using a hand sanitizer is okay. With some resistant virus, it will not be a suitable way to disinfect hands. Okay. I wanted to answer this question because it's really in relation to what I just said, and I want this to be clear. So a sanitizer, if you have something which is highly sensitive, like this SARS coronavirus, could possibly be used, and that's what we use when we use hand sanitizers. Could you give me the screen again, please? Okay, thank you. So now we'll look a little bit more at the contamination control with respect to SARS coronavirus, and mainly we'll see what are the needs and what are the approach that could be used depending on the situation of the different organizations and institutions. So there is a real need to control SARS coronavirus because we are in a pandemic. So it's highly sensitive, but that virus still has a number of worrisome characteristics. It's highly transmissible, it's potentially deadly, and it has killed many people. The infectious dose, which is the dose that is needed to infect one individual, is unknown, and it might even be variable depending on the condition of those person. So this is an information that we have for a number of biological agents, but we don't have it for coronavirus. It's a pandemic context, so it's also, as a society, we need to stop the transmission of that virus, and so we need to have an optimal infection control everywhere, I would say, starting with hospital and labs, but also in households if there are some cases. Also, it's more than likely that in some settings, and that could possibly be some hospitals or labs, the practices are not always optimal. So in that case, if we want to have that good infection control, we need to improve the quality of what we do there. Then there might be some special needs, and I'm especially thinking about the masks, the good masks. I mean, there was a shortage. I'm not sure that the shortage is complete, is not an issue anymore. And in that case, it's and there might be some lower level masks that we receive. In that case, it might be useful, necessary to decontaminate some masks, reuse them. And then there are also the aspect of limited resources. We need to take also the economic aspects into account. So we always need to find solutions that are suitable, but that we can apply in the long term, that are sustainable. So that's mainly linked to the economic aspects. Anyways, we'll need, with respect to decontamination, we'll need to fill all possible gaps to increase the effectiveness of infection control. So what do we actually need? Simple cleaning, simple wiping with some type of disinfectant, really exposing for a longer time with disinfectant, or do we need to spray the rooms? Actually, it depends. It depends on the situation. And so to my question, what term should we use when we think about stopping coronavirus? Actually, the term that I think is the most appropriate is decontamination. We need to make the situation safe for further use. We need to make the situation safe. We could sterilize, but if we sterilize, we'll need to use very tough process, expensive processes, and so on. And in most situations, it's not possible. So we really need to do what we call decontaminations. That means think of the situation to decide what treatment will be sufficient in our case to make the situation safe. So that's why that's the answer that I prefer, decontamination. It's not because the agent is a pandemic agent, for instance, that you need sterilization. Since it is highly sensitive, you don't need to get to such a level. You don't need to inactivate spores and so on. So decontamination is enough, and the exact thing that you will need to do, that needs to be defined on the basis of the situation. And I will give example later. Those who answer that it depends on the context, I also agree with that answer, because it's totally different to decontaminate a culture of coronavirus when compared to disinfecting a bench or a floor in a hospital. So what decontamination techniques need for coronavirus? And here I think that's a very clear answer, but I cannot. Actually, the answer is depends. It depends on the situation. There might be different levels of contamination. For instance, a culture, for instance, contaminated samples, some potentially contaminated samples, some samples which are not contaminated, but we don't want to take any risk and we want to take some security there and so on. So it depends also on the infrastructure, equipment, materials, what is exactly contaminated, and how and what approach can we use to decontaminate those different elements. And then it's also a question of technical means that are available. There are limitations everywhere, but in Pakistan there might be a limitation in the products that you can purchase that you can just find to do some of the direction. So you also need to think about what is available at your place and what are your technical and logistic means. It's also it depends on the level needed to consider further use safe. If it is something that you want to use for culture, for instance, in a lab, in that case, you need to be sure that everything is eliminated so that you don't contaminate your next sample. You don't want to have cross-contamination. If it's in a hospital and you have like surgical device that might be contaminated, in that case, you need to really be extremely careful, because in that case, you will infect for sure other person and so on. If it's a culture, it's highly concentrated. In that case, you need a very strong way to decontaminate. If it's good, which has been taken like 1 week before and so on, and you have stored it and then you want to destroy it, it's totally different. It's much easier to get rid of the virus. So the choice of the decontamination technique depends on all of the different things, and in that case, like in many situations, we need to use our knowledge. That's one thing, but also our personal judgment or common sense. Using our knowledge, we need to know enough about SARS coronavirus 2. There is a lot which is published. There are some summaries also. We need to also know our activities and the risk related to our activities. And that's something that only we, people who work in a lab, who work in a hospital, can do. It cannot come from outside. You are people who work in a lab, or manage a lab, or work in a hospital, are in the best position to know the activities and also to be able to define what are the related risks. And then we also need to have some knowledge of the disinfectants and their performance. And that's something that we'll discuss in the next session, for instance. And we also need about other decontamination techniques like autoclaving and so on. What can really be achieved with an autoclave? We also need to use our personal judgment or use some common sense. First, to evaluate the options. Is an option like a disinfectant and so on really something which is needed, or is it just nice to have? If it's just nice to have and not really needed, especially if it's expensive and it really and so on, you might just not choose that option. And we always need to evaluate the feasibility in our own situation. There are treatments which have been developed and which are extremely efficient. I mean, if you look at the rate of inactivation, for instance, but which cost much are technically too complex and so on, and unaffordable for most institutions. We also need to use common sense to distinguish what makes sense from what does not. So one thing I want to insist on in some way is that there are many commercial initiatives, and some people really try to take advantage of the pandemic situation to sell almost anything. And it's true for masks, it's true for a number of things, but it's also true for products that look like disinfectants, or for some new machines to disinfect things or to decontaminate things. Just an example, and it's an extreme example, and that was developed in the West. It's a machine with UV light to decontaminate food, like apples, for instance, on this picture. I mean, the virus is extremely sensitive. It will die in contact with the air. And anyway, it would be extremely easy to wash the apples rather than purchasing such a machine and for something which is almost useless, I would say. Then there are also some political decisions that are made just to show that something is done. The example is this: when you see in relation with the coronavirus crisis in a city, trucks that are spraying disinfectant on the street, it's totally ridiculous, because even if the virus is there somewhere, it will mostly be in people, not on surfaces. It will not survive on surfaces. This is a huge effort for no effect, except perhaps have some influence on judgment. So just to tell you, we need to think about what we do, and we need to really look at things in a reasonable way at what we do. And then we need also to decide what risk control is reasonably achievable in our own situation, given our own means. So what treatment process can be used for decontamination of SARS coronavirus? Again, it depends on the purpose. You will need to look, will the object that we want to decontaminate be used for sterilite, or just for clean work, for safe reuse, for safe elimination in the case of waste? That means that you might decide different levels of decontamination. Also, we might want some decontamination to protect the product, for instance, for food, for patient protection in hospitals, and also in a household when there is a case, or for biosafety, mainly to protect the people who work in the lab or in the hospital. Also, we need to look at on the biological agent and the real threat from that biological agent. And so, in general, we need to look at the characteristics of the such as pathogenicity, modes of transmission, and so on, at resistance pattern, and so on. And of course, in the case of SARS coronavirus, we know more or less that profile now. We don't know everything. We also need to take into consideration the risk of infection depending on the type of exposure. And so there are some guidelines which are much used in hospitals, but also in the industry, that define the situation as critical, semi-critical, or non-critical. So critical would be if you have an exposure of internal, normally sterile areas of the body, or normally sterile products, I would say. And that examples are invasive surgery, injectable drugs or vaccines, and so on. That's considered critical situations where you need to really use very strong means of decontamination. And it can be sterilization in some cases. Semi-critical situations when, for instance, mucosa could be exposed. It's the case for oral products. It's the case for a number of things that we use in laboratories. And in that case, you need to have some level of decontamination that make it safe, that you don't expose, that in case of exposure of your mucosa, people don't get infected. Then there is the non-critical situation when only the skin can be exposed. That's true for the lab equipment, like also the bench tops, for the bedding in hospital. All that, those things are considered non-critical. And then it's really not critical, and it's called environmental, when there is normally no contact with the skin, and that's, for instance, for the floor. If you look at that, you will use very different means to decontaminate, because you cannot always use the very high level disinfectants, which are expensive. We have a number of drawbacks and so on. And in some cases, you need to adapt the answer, your response to something which is much more modest, but which achieve the purpose of making the situation safe. And then just to mention, in some situations, there are also regulatory requirements and codes of practice. It's, for instance, the case for pharmaceutical manufacturing. Now, and this will be my last slide, what is needed for SARS coronavirus 2 inactivation? And sorry, mostly the strategy that you need to think if you are responsible for a lab, for a number of labs, for hospitals, for an organization, and so on. If your hospital or laboratory, if they in those you already do sterilization, in that case, there is nothing to change. The virus is so sensitive that in doing sterilization, it will be killed. If you also use high or intermediate level disinfection, that's also sufficient to totally destroy the virus. So in principle there is nothing to change. If you do that, you're already on a safe level, okay? Still, it's worth looking at very closely at the process to be sure that what you do is really effective, okay? But with that level of sterilization, of high level intermediate disinfection, if you use that, and if you do it properly, with respect to coronavirus, you are on the safe side. Then you could have some other situations where you only use low level disinfection, sanitization, or no treatment at all. It could be in hospitals and so on, but it could be in some other parts of those institutions, I would say. In that case, you need to look at the risk and to consider the possible need to initiate some kind of treatment or to improve the treatment. And so in that case, there might be some need to really modify the practices to really be sure that we control the risk of transmission, of dissemination of coronavirus 2. And in any case, you need to choose the appropriate available treatment depending on what's available locally. And this is why in the next sessions, I will not speak about all the treatment that could be used, but I will focus on possibilities that are accessible in Pakistan. So as I said, it was my last slide. I will just introduce the next sessions. The second session will be focused on chemical disinfection and decontamination. So we'll really speak about disinfectants and other chemical products. We'll see the main properties of the main types of disinfectants that you can find in Pakistan. And we'll also look at how to choose a disinfectant for a given application, because all disinfectant can not be used for everything. The third session will be on autoclaving. We'll look at the autoclaving principle, also the way to validate an autoclave, and some do's and don'ts about autoclave. For those who followed the workshops that were organized 2 and 3 years ago about waste management, this session is a summary of the session on autoclaving during those workshops. And then finally, session 4 will be really the question and answers focused on SARS coronavirus. So during that session, I will, and perhaps I will help me for that, we will collect all the questions that you are asking to the chat box, for instance, and kind of sort them and so on, and try to find the most appropriate answers. That's the work we will do for the fourth session. And so during the next session, you please keep asking questions to the chat box. If you want to ask the question another way because you don't want to spend time with the chat box, in that case you can address them to the PEPSA office at the 2 addresses that are mentioned there. So that's it from my side, except that there might be some question that I should answer immediately. Otherwise, Mashal, could you please translate?
इस आखिरी सेशन में हमने कोरोना वायरस को किस तरह कंट्रोल करना है, हम कौन सी तरीके इस्तेमाल कर सकते हैं उसको डिकंटामिनेट करने के लिए, हमने वो डिस्कस किया. सॉरी, मेरी स्क्रीन स्टक हुई हुई है. ओके. तो सबसे पहले हमें याद रखना चाहिए कि जो कोरोना वायरस है वो हमने इससे पहले भी डिस्कस किया कि वो हाईली सेंसिटिव है, उसको ख़त्म करना रिलेटिवली आसान है, लेकिन हमें कुछ और चीज़ें भी ध्यान में रखना ज़रूरी होनी चाहिए. एक कि वो हाईली ट्रांसमिसिबल है, एज इन वो बहुत जल्दी फैलती है. इसके इफेक्ट्स अगर एक बंदा इन्फेक्ट हो जाए और उसको पहले से कोई बीमारियां हो या वो किसी एज ग्रुप में हो तो ये जानलेवा भी हो सकती है। हमें अभी तक ये नहीं पता कि कितने एक्सपोजर के बाद ये वायरस हो सकती है। एंड कुछ प्रैक्टिसेस, कुछ सेटिंग्स में कुछ ऐसे प्रैक्टिसेस होते हैं जहाँ पे वो SOPs वगैरह ठीक नहीं फॉलो कर रहे होते, उनमें वो ज्यादा फैल सकती है। तो और स्पेशली पाकिस्तान जैसे कंट्रीज में जहाँ पे बजट कंस्ट्रेंट्स होते हैं, तो उसके लिए भी हमें ध्यान में रखना चाहिए कि हम किस तरह बेस्ट SOPs बना सकते हैं जो सब फॉलो कर सके, ताकि जो वायरस है वो ना इतना फैले। तो ये गैप्स और इन चीजों को आइडेंटिफाई करना बहुत जरूरी है अगर हम सही तरह से इस वायरस को कंट्रोल करना चाहें। तो फिर क्वेश्चन आता है कि कौन सी सबसे इंपॉर्टेंट डिकंटामिनेशन टेक्निक में कोविड वायरस, कोरोना वायरस के लिए। एंड इसका आंसर ये है कि वो डिपेंड करता है सिचुएशन पे, आपका एक्सपोजर कितना ज्यादा है, लेवल ऑफ वहां पे कितना ज्यादा कंटामिनेशन हो सकती है, आपके जो इर्द गिर्द जिस एरिया जहाँ पे आप इस लैब में या हॉस्पिटल में आप काम कर रहे हैं उसका इंफ्रास्ट्रक्चर कैसा है, फॉर एग्जाम्पल वहां पे वेंटिलेशन वगैरह कैसी है, और आपके पास खुद कितना बजट है, कितना आपके पास रिसोर्सेज हैं जिनको आप इस्तेमाल कर सकते हैं वायरस को कम करने के लिए। तो इसलिए बहुत जरूरी है कि हम अपनी नॉलेज को इस्तेमाल करें और वो देखें कि लाइक ये किन चीजों पे बेस्ड है। लाइक हम एक्टिविटीज देखें, हम देखें कि कौन से डिसइंफेक्टेंट्स हमारे पास हैं और हम कौन सी डिकंटामिनेशन टेक्निक्स इस्तेमाल कर सकते हैं। तो इन सबको हमें रखते हुए हमें अपने ऑप्शंस को एवेल्युएट करना चाहिए, देखने के लिए कि हम बेस्ट तरीका सबसे रीजनेबली हम किस तरह इसको डिकंटामिनेट कर सकते हैं। और इस वक्त हमें ये भी ध्यान में रखना चाहिए कि पेंडेमिक के अंदर बहुत से लोग इस बात का फायदा उठाना चाहते हैं और वो अब आपको डिफरेंट चीजें नजर आ रही होंगी, आप व्हाट्सएप पे लाइक डिफरेंट सोशल मीडिया पे चीजें आ रही होती हैं जिसपे लिखा होता है कि ये खरीद दो या वो खरीद दो। बहुत सी ऐसी चीजें जिनका कोई फायदा नहीं है और हमें इस बात का ध्यान रखना चाहिए ताकि हम अपने रिसोर्सेज और पैसे इन चीजों पे जाया ना करें। तो अगर हम देखना चाहें कि लाइक फिर जो प्रोसेस होता है डिकंटामिनेशन का यूज, वो किन चीजों पे डिपेंड करता है, इसकी समरी में 4 चीजों पे। सबसे पहले कि हम किस पर्पस पे वो है, हम जो कर रहे हैं डिकंटामिनेशन वो हम कहाँ कर रहे हैं, हम अपना सेफ यूज के लिए कर रहे हैं, हम वेस्ट एलिमिनेट करने के लिए कर रहे हैं, हम अपने प्रोडक्ट को प्रोटेक्ट करने के लिए डिकंटामिनेशन कर रहे हैं, या हम पेशेंट को प्रोटेक्ट करने के लिए इन्फेक्शन कंट्रोल के लिए डिकंटामिनेशन कर रहे हैं। तो सबसे पहला पॉइंट उसका पर्पस क्या है। दूसरा जो डिकंटामिनेशन होती है हमने देखने हैं कि इसके बायोलॉजिकल थ्रेट्स, जो एजेंट है उसके थ्रेट्स क्या है, लाइक जो जिसको हम डिकंटामिनेट करना चाह रहे हैं उसके कैरेक्टरिस्टिक क्या है, कि उसका मोड ऑफ ट्रांसमिशन क्या है, वो रेजिस्टेंट है या नहीं है, उसके सर्वाइवल चांसेस क्या है। फॉर एग्जाम्पल स्पोर्स जो है वो बहुत मुश्किलों से खत्म होंगे। थर्ड चीज जो हमें देखनी चाहिए कि जो रिस्क ऑफ इन्फेक्शन है वो एक्सपोजर क्या है। फॉर एग्जांपल अगर क्रिटिकल होगा, अगर नॉर्मल स्टेराइल एरियाज में फॉर एग्जांपल इन्वेसिव सर्जरी वगैरह में उधर एक्सपोजर का रिस्क ज्यादा है तो उधर डिकंटामिनेशन प्रोसेस भी डिफरेंट होगा। सेमी क्रिटिकल में होगा कि फॉर एग्जांपल ओरल प्रोडक्ट्स यूज करते हुए, नॉन क्रिटिकल में अगर सिर्फ स्किन एक्सपोजर हो रहा है, और एनवायरमेंटल में अगर कोई डायरेक्ट कंटेंट नहीं हो रहा, फॉर एग्जांपल कंटामिनेशन फ्लोर्स पे है या फिर सर्फेसेस के ऊपर है। और जो तीसरा हम जो प्रोसेस जो जिस पे डिपेंड करता है कि आपके अपने गवर्नमेंट की या हॉस्पिटल की यहाँ पे हम जहाँ पे भी हैं उनकी कोड ऑफ कॉन्डक्ट उनकी प्रैक्टिसेस क्या है, लाइक उनके अपने गाइडलाइंस क्या कह रहे हैं। इन सब चारों चीजों पे बेसिकली जो डिकंटामिनेशन का प्रोसेस है इन पे डिपेंड करता है और इनके हिसाब से वो डिफरेंट होगा डिफरेंट जगहों के लिए। तो अगर ये तो हमने जनरल बात की, अगर हम आ जाएं कोरोना वायरस के ऊपर, उसको इनएक्टिवेट करने के लिए हमें किस चीज की जरूरत है। तो इसमें हमें ये याद रखने की जरूरत है कि अगर आप जिस जगह पे काम कर रहे हैं, फॉर एग्जांपल आप एक हॉस्पिटल में काम कर रहे हैं, यहाँ पे एक लैब में काम कर रहे हैं जहाँ पे ऑलरेडी स्टेरिलाइजेशन एंड डिकंटामिनेशन टेक्निक्स प्रैक्टिस होती हैं, फॉर एग्जांपल हर सर्जरी के बाद प्रैक्टिस हो रही है, तो उसमें मोर देन लाइकली आपको कुछ एक्स्ट्रा करने की जरूरत नहीं है। आपकी जो अपनी टेक्निक्स एंड गाइडलाइंस प्रैक्टिस हो रही हैं, अगर वो सही तरीके से हो रही हैं, वो काफी होंगी। लेकिन इसमें बहुत जरूरी है कि आप देखें कि कोई लाइक आई थिंक ये टाइम बेस्ट है अपनी प्रैक्टिसेस को दोबारा वापस जाने के लिए और उनको एवेल्युएट करने के लिए और देखने के लिए कि उनमें कोई कमी पेशी तो नहीं है, और अगर है आप उनको किस तरह पूरी कर सकते हैं। अदर सिचुएशंस में फॉर एग्जांपल जहां पे नहीं हो रहा, आपके अपने गाइडलाइंस एंड सिस्टम इन प्लेस नहीं है, फिर आपने उसमें देखना है कि आप उसको इम्प्रूव किस तरह कर सकते हैं और अपने रिसोर्सेज को नजर में रखते हुए कि आपके लिए सबसे अप्रोप्रिएट क्या चीज होगी। Philippe, if you have any questions you would like to address at this moment.
I look at the questions. There are really many, and many on disinfectant. So that will be mostly for next session. No, I don't think there is anything related to or specifically related to what was just developed now. So I'm still looking. No, I don't think anything that I need to answer right now. So, but to the participants, we'll keep all the questions and we'll really try to answer them. If not during the next session on disinfectant, and the other questions will be answered at the two last sessions, especially the last session. So don't worry. So yeah.
Okay.
So should we finish?
Yes, it's 6:05. Yes, I think we should